reading lately is that when women get sick, sometimes the support systems that they thought they have don't necessarily stay in place.
Mm.
Fortunately, in South Africa, we have access to really, really good doctors. When we have access, we are able to employ good methods of testing. I mean, Discam has a cervical cancer awareness now and again, clicks as well,
Right.
pap smear, and it's great that we are able to afford women in this country that level of care for themselves.
Yeah, I think you touched on something very important and something that we're very aware of, especially at Lady Liberty, that most of these, even just this conversation, is a privilege. There are so many women in communities or situations that don't enable them to even have data to join us, or they don't necessarily have easy access to a Discam or to a Clicks. I don't know, it's not really connected, but I'll ask it together anyway. Are there any sort of natural ways for one to either strengthen their immunity or
Mhm.
to combine treatments with the sort of strictly medical side of things for when either a person can't afford or access medical treatment? Can you talk a little bit about access, and what you find in the space, and if there's anything we can do, maybe just to promote a little bit more of it?
Mhm. That is a very fair question, and I think that access to medicines and access to healthcare is it is enshrined in our constitution. You know, everybody should have access, but the reality is that not everybody does have access, especially at this level, as you've highlighted. So, from our side, I'm going to address your first point. Number one, how to improve your own immunity. The biggest thing is honestly diet and exercise. I know everybody's preaching this at this point in time. New year, new me. Hello, January. But having a good diet and having a diet high in fiber and what else? Lots of water, not too much water, a decent amount of water. Let's not flood your tissues. Sleeping enough also conserves your immunity. Making sure that if you know that you're anemic, take your iron tablets. If you know that you
Mm,
have some kind of deficiency, try and get yourself better. And if you are high risk, then make sure you go for regular pap smears, make sure you go for regular checkups to ensure that everything is actually working fine. To your second point regarding access, that is a conversation in and of itself. One of
mm,
the modules that we at Diverse Conversations train on is managed healthcare and access to
right.
medicines. And we look then at the country as a whole. What are the systems in place to ensure that more people have access to medicines? What is the role of the pharmaceutical company to ensure that more
Yeah.
people have access to medicines? We look at scheduling. We look at where certain medications are, the pricing thereof, how does it affect the
Mm,
end user? And how do we empower doctors to ensure that they make the right choices for their patients wherever they are? We
right.
know also that some clinics only have Panado for flu,
Yep.
for cold, broken leg, broken hip, giving birth, everything,
Everything.
only Panado. And the idea with the NHI is that we improve ward-based care so that more people can have access where they are, not walking 18 kilometers, 8 months pregnant to go and get a clinic checkup. But that's the reality of the situation in South Africa at the moment. And hopefully, if NHI works well, if it's run properly, this we would improve access to medicines, improve access to healthcare, and
Mm.
empower our women, empower people to make conscious decisions about their health to the betterment of the nation of a whole.
Yeah.
And I'm getting goosebumps, but that's what we want, empower people. And
Yeah.
the pharmaceutical companies do have a massive role to play because that's where we get our medicines from. And even the vaccines, that's where our vaccines come from. On the government side, we have Cervarix, which
Yeah.
is 197 Rand per dose. And you need multiple doses of the vaccine to get enough protection against cervical cancer. And this
Whoa,
is
sorry.
true. Yes?
Sorry, can I stop you right there?
Yeah.
So are you saying we can get vaccinated against HPV, and that's the Cervarix that you just mentioned,
Yes.
which is 197 Rand?
Yes, per dose.
Who should get the vaccine at what age? Is
So
Yeah,
currently it's for girls over the age of 9.
9.
9. And I don't know if you've seen the recent statistics. The Minister of Basic Education was last year complaining that more and more girls are falling pregnant, that they're dropping
Pregnant.
out of school. Are the girls the problem when you have age discordant relationships with men who are
Yeah.
not only um, in relationships with these young girls, but probably with other girls as well?
Yeah. That is like a topic that makes my blood boil. I can actually
Mm,
feel I'm getting upset just thinking about it because there's like a whole thing we can go into. But I see there's another question.
mhm,
Thanks, welcome. Cervical cancer is quite an intimate disease given where it occurs. So, how can men support women in preventing the cancer without being invasive or
mhm.
centering themselves in the conversation? That's a great point, and it
That
also
is
makes
very,
me actually
very
just want
good.
to say thanks to the men who are in
Mm.
this call. But yeah, maybe we can just talk a bit about that and respond to the question. I'm also aware of time, so unless
Oh
someone
dear.
has something pressing, this might be close to, let's say, the one who can take one more. But yeah,
Mhm.
how can men support women?
If you say that you are supportive of women,
Mm,
you need to be able to listen. And this is true for everybody. So active listening is a skill that I try and impart as much as possible when I'm in a training facility.
mm,
And let's say a friend of yours mentions that, okay, this is strange for me. I can't do this because I'm bleeding, or there's pain over here or something. Is it normal? Is it not normal? And then be able to have those conversations with her. But you need to create that space.
right.
And I don't know that we'll be all having these conversations about cervical cancer around a cheese board, but that would be nice. And as a man, if you are in a relationship with a woman and it is a sexual relationship, also be aware then of maybe like blood being left behind in the condom,
Yeah.
or random bouts of bleeding, or any pain or fever that could be associated. Because yes, cervical cancer is an issue, but also other infections, and that could be associated with the bleeding.
Mm,
But when I hope Welcome is still here. I hope Renette is here as well. Let's check. When giving feedback like that, that is a little bit sensitive, you position yourself in a certain way that allows the other person to respond only if they don't feel threatened.
yeah.
So I have noticed that the last time we had sex, you started bleeding. And this concerns me because this is unusual for us. Your
Mm,
period ended 2.5 weeks ago, and it's worrying for me. How do you feel
mm,
about that? Have you
mm,
noticed any changes? And then you wait for
mm.
feedback. If, oh, okay, that's actually true, I didn't notice it before. Let's check and see if this is a common occurrence. And then if it is, let's go check it out. This chemist down
Yeah.
the road, there's a clinic down the road. Let's go in and find out and see. Oh, my cousin's sister or my cousin's husband, someone's a nurse. Let me ask the nurse, and you get more
Mm,
information. In so doing, you are not centering yourself. Also, you're identifying that this made me uncomfortable. This is a concern of mine, but I'd like to get your feedback. And being open to feedback. Feedback is a gift both ways, and feedback is
right.
feedback. So the language that we use with ourselves and with our partners is very important. And obviously, it's a
Right.
sensitive topic. Thank you for bringing it to the table, Malcolm. I hope I've answered your question.
Definitely. Thank you so much for that. And I think, correct me if I'm wrong, but I think some of it has also a lot to do with the nature of the relationship that you're in to even have open communication about these things. So if you already have a safe space within the relationship, it might be a bit of a
Mm,
natural progression to say, hey, like you're saying, I've noticed this. Have you noticed? Would you like to talk about it more, explore more, talk to someone else
mm,
about it? But just putting things out on the table and hoping the lady then feels safe enough to say, actually, a good point. And I mean, this can
absolutely.
extend also to like your sibling or something happens. If you've noticed maybe your sister's in constant discomfort or she's crying, or she's talking about abnormal
Mm,
bleeding or something going on. So we're not, I think also depending on how people grow up, there's a genuine ickiness that comes with talking about
very true.
blood or, talking
Yes.
about blood or the period. If we start demystifying some of these things, it might lead to the healthier conversations around
Hmm.
it, which then could prevent some massive issues. So, any key takeaways before we disappear? I'm enjoying this conversation. I'm just just also conscious about time. People probably want to settle in and watch some TV, shut their minds off to cancer and just adulting for 5 minutes before we have to adult tomorrow.
Yeah,
Any sort of final takes? Yeah.
Grab it.
Right.
Can I just add I'd like to make 2 final points before we move on.
Absolutely.
So the Cervarix vaccine is available. Oh, okay. Why are there balloons?
Balloons, I don't know. It's
Okay.
okay. We saw the balloons. We like balloons.
The Cervarix vaccine is government backed, so it's 197
Okay.
rand, and we
Yeah.
need 3 doses. Similarly, the Gardasil, so the Cervarix is 2 strain, the Gardasil is 4 strains. The Gardasil is slightly more expensive and
Okay.
also available from the private sector. So that's between 650 rand and 800 rand. You also need 3 doses.
Okay.
And with this vaccine, I think it's 1 dose every 3 or 6 months. I have to go back and I'll check. But you're boosting your antibodies every time you're exposed to the vaccine. And this goes back to like fundamentals of immunology, in that your first exposure is, okay, I've been exposed. Okay, cool.
Yeah.
Next exposure is a little bit more robust. The third exposure, our body is like, right, we're primed, we're ready, we're good. Let's make sure the antibodies are there and good to go
Right.
if we are ever exposed in reality. So 2 strain versus 4 strain, Cervarix versus Gardasil. My second point is also that it's not just women who can be exposed to HPV. HPV is men as well, and HPV can also cause esophageal cancer. So it's not just cervical cancer. Remember, the squamous epithelial cells is also like our whole gut, our whole internals, our tubing.
Okay.
There we go.
Right. Okay.
It runs all the way through. And
Okay.
I'm actually going to post a link. I saw yesterday that the Scottish government actually announced that the rates of cervical cancer have actually greatly reduced, and there's no cervical cancer in women who have had the vaccine.
Okay.
So I'm going to post that link in the chat, or is it Q&A? Where can I post?
Doesn't matter. You can throw
I'll
it
post it in
wherever.
the
I'll
chat.
copy paste to the other. Yeah. Thank you.
There we go. So the vaccines do work, and you want to ensure that people are as healthy as possible. And I can think of people in my life who this vaccine would have who this vaccine would have prevented from dying earlier on, who this vaccine would have allowed them to retain their fertility for extended periods of time, because it does. Yeah, cancer is not the blood pressure increase when you mention cancer is valid.
Right.
I hear you. It can be very scary.
Wow. Thank you so much. Any last questions, thoughts, or points before we go? I know it's also quite a sobering conversation, but good to have nonetheless. I've learned so much, and will definitely be sharing this with people in my life, and just having the conversations a little bit more, and also just paying more attention to my body as well. But any last thoughts before we disappear? Also, Kirsten, anything else on your side? From my side, if you do have questions that perhaps you're a little bit too shy to ask, or you're needing a little bit of privacy to talk about, please send us an email. I'm going to throw our email address in the chat and maybe in the Q&A. It's hello@ladyliberty.org.za. Or you can just pop a DM and someone will get back to you. And if you're wondering what else we can do for you, you can reach out to us if you need legal assistance, if you're in an abusive situation or relationship and you need access to the courts or something related to legal information. If you need a safe space or a shelter, you can also give us a shout. We'll do our best to link you to one depending on your geographical location, etc. If you need some trauma counseling or therapy, please also reach out. Or lastly, particularly related to today's topic, if you have some physical sort of bodily concerns, either related to GBV or not, please also pop us a message and we'll do our best to connect you with the respective experts and partners that are working with us. But from my side, that is it. It was a really sobering chat, but I'm glad we had it nonetheless. And Kirsten, I really appreciate your time. I'm sure we'll have more conversations. Any parting shots from you before we release everybody?
Releasing everybody to Netflix and the couch. All good.
Yes, and toddlers that I can also now hear whispering nearby.
The joys of motherhood.
Okay.
So yeah, just from my side, thank you so much for the opportunity. Thank you for trusting us with this topic. I think at Diverse Conversations, we try to ensure that we empower as many people as possible. And thank you for allowing me to talk. I can talk all day. It's my job to talk.